hygiene school graduates last year. Was it last year or year before? Just
last
so
year.
long ago.
Yeah. Seems forever ago, but it was just last year.
How is it?
It was good.
So, do you remember it? Have you gotten out of that dark place yet?
It wasn't dark. It was a good experience. It was the most challenging thing ever, but it was good.
How's private practice?
I love it. I enjoy it a lot. I'm not currently practicing because I just had a baby, so I'm just enjoying being a mom right now.
Yay.
But I'll go back this year for sure.
Yeah, and she's doing her bachelor's course, so she wants to maybe teach this sometime in the future. So you guys are her guinea pigs. So be nice. She's going to get ready, and I'm just going to talk a little bit about the rest of the semester. You can go ahead and went to Harmon's.
Yeah, I did. I went to Harmon's.
Okay, you guys know you'll have a guest instructor next week, right? Okay, be nice to her. Okay, I want to be able to ask her to cover for me again. So you guys be nice, be on time, help her with the technology. In fact, I'll see if I can get a hold of her, and maybe we'll do something on Thursday. So I'm not sure exactly whether she's going to present PowerPoints or what she's going to do. I think, anybody have their syllabus handy? Because I don't.
Yeah.
Thank you. Like the new one that I gave you guys a couple of days ago? Yes, fabulous. Alrighty. So we have spring break. Anybody doing anything really fun? No one going to Mexico or anything? I'm going to Seattle. So.
I'm going to California.
Yay! See, that's fun.
Yeah.
Okay. When you guys get back, okay. Okay. So you'll have your guest instructor next week when you get back from spring break. I won't be here. The week after that, we'll do dental materials, and assignment 6 is due, and then you'll have a test. So you will see me again before your next test. So you guys don't need to stress too badly. If any of you, I know there are quite a few of you that have missed different classes. If you have, and you're concerned about the information, it's going to be a tough test, this next test. So if you need to make an appointment with me during office hours to go over any information I missed, make sure you do that week when I get back. Any questions on anything so far we have covered this semester? You guys having a great time? It's midterm already! Holy cow, look at this. The sun is shining. It's at my tan. You see my sunburn? You know where I got this? Any of you here earlier? We had pharmacology class out there. And we'd have dental material, we'd have hygiene FYE out there today, but I think Miss Webb's got a PowerPoint.
Yeah,
She'd be kind of mad if I was like, well, we're going to just move it outside. So,
I got that.
but it was so fun. Thank you. So I will just turn it over to you.
So,
oh, hang on, you. Where's it? Oh, weird. Where's our? Screen that there for me. Oh, what's this?
well, she knew how to get it to
in the bottom right hand corner. Bottom right hand.
Oh, right here.
Yeah, right there.
It's different than my computer. I was looking over here.
There's that little thing there. There you go.
Okay. So, we have a very exciting subject today, instrument identification. Something that might seem overwhelming as a new dental hygiene student is being able to identify instruments. Because there's so many out there all look so different. But with the knowledge that you'll be given today, hopefully you'll be able to identify the differences between examination instruments and treatment instruments. You'll be able to differentiate between certain instruments by their appearance, and you'll be able to identify instruments' functions. So we have 3 different parts to an instrument. There's the working end, there's the shank, and the handle. So we're going to talk about those 3 parts. Here's the working end. It's pointed out right here. And this determines the purpose of the use of the instrument. So just by looking at this end right here, you can determine what this instrument is used for. Each instrument has a different function, and it depends on the working end's design of what that function is. So the shank connects the working end, this is the working end, connects the working end to the handle, and it gives it shape and rigidity, and it also helps give access to the certain area that you're trying to access in the mouth when working in the mouth. So,
I know. You guys don't have this PowerPoint. I will get a copy for this one and I will post it for you. But the stuff that's on the PowerPoint that's posted is very similar. But I will make sure that this one is posted for you.
So when talking about the shank, there is this simple shank, and there's a complex shank. Simple shanks are known as straight shanks, so there's no bend, it's just all in one plane. And you also have a complex shank, which is bent in 2 different planes, sometimes more than 2 different planes, and it's also called an angled or curved shank. You have rigid shanks, they're larger in diameter, so when you're using pressure, they're better able to withstand the pressure, and you're able to remove calculus with shanks that are more rigid. Then there's flexible shanks. They're thinner in diameter, and they're used against heavy deposits of calculus. What happens is it would flex or bend. Then we have the functional shank. It's the portion of the shank that allows the working end to be adapted to the tooth surface. And we have the lower shank, which is the portion of the shank nearest to the working end. So if we go back up here, this would be the lower shank right here, because it's closer to the working end. And then this would be the functional shank right here. And then we have the handle. This is what you are grasping when you're doing instrumentation. There's lots of different designs, lots of different weights and diameters and surface textures. And the reason why they do this is because all clinicians prefer different things. I think also they came out with the larger diameter handles to allow for lesser fatigue when you're working as a clinician. It's better with the larger diameter handles. And then the texture makes it easier when you're gripping the instrument. So you're less likely to slip. You have more control with your instrument. And you also have single-ended or double-ended instruments. So this instrument right here would be double-ended because you have 2 working ends. Single-ended instruments are less efficient. Double-ended instruments, they allow the clinician to simply flip the instrument to use the other working end. So just by a raise of hands, if any of you want to answer, what would make a single-ended instrument less efficient?
Just because like the dentist, I'm a dental assistant, and it's easier for me if they're like double-ended. Just because you don't have to like grab another one, you can just simply like flip it over instead of like scrambling through all the other instruments.
And it really does make a difference when having to look over at the tray to grab another instrument, when you can just stay in the mouth and simply just flip. It saves a lot of time. So Very good. And then most double-ended instruments, you have paired working ends and you have unpaired working ends. So the paired working ends, they're pretty much exactly the same instrument, it's just a mirror image of each other. So you're using it on different surfaces, but it's the same purpose and it's the same instrument. The unpaired working ends, they have dissimilar working ends. So you might have like an assessment instrument that's a probe on one side, which we'll talk about later, and then on the other side you would have a furcation probe, which would be a different probe, but it also helps assess something. That way you don't have to switch instruments. So here's a paired working end. This right here is an Explorer, which we'll talk more about later. And it has a paired working end. They're the same working end, but they're mirror images. This one's unpaired. So you have a probe right here. And then you have the shepherd's hook Explorer on the other hand. So that's an example of unpaired. So when you're identifying an instrument, you want to look for the writing on the instrument handle. If you're not able to identify it just by the appearance, you can look on the handle and it will say the school or individual that was responsible for the design or development of the instrument. So that would be the name. So an example of that would be a Gracie. And this was a doctor that designed 14 original single-ended instruments in a series, and they all bear the name Gracie. So you'll see that instrument a lot. The design number is written also on the handle. So this would be Barnhart 56, and that would be the design number. So combined with the design name and the design number, you have the identity of the instrument. Also, when looking at the working end to identify it, when you're looking at the writing, if you have an instrument that has writing this way, and it says like Gracie 1112. So the working end for the 11 would be this side, and the working end for the 12 would be this side. So the number closest to this side is what identifies this working end, and the number closest to the other side, this side right here, identifies. So you're basically looking at the numbers, what end is it closer to, and that's what it identifies. And then you also have sometimes instruments where the writing will be this way. So the first number is what's identifying the instrument working end at the top, and the second number is what's identifying the instrument at the bottom. So kind of a poor drawing, but hopefully that makes sense. So when it's marked along the handle, each working end is identified by the number closest to it, and when it's across the handle, you look at the first number, which identifies the working end at the top, and then the second number, which is on the right, and it identifies the lower end. And then another thing that's helpful, I absolutely love colored instruments. It's just easier. For instance, American Eagle, they have color-coded instruments, and usually they're all of their instruments that you would use for anteriority. Do you guys know anterior? Yeah. Those are color-coded purple. So, and then all of their universals, I believe, are blue, and then like their Gracies would be, or the posterior, I think it's in yellow. It's been a while since I've done this, but I love it. It's easy to just look at your tray and know what instrument you want to pick up, and you don't have to fumble through all your instruments trying to look at each end. So, when it comes to periodontal instruments, you have assessment instruments and you have calculus removal instruments. assessment instruments or examination instruments, you can break those down into periodontal probes and then also explorers. And then,
guys, you need to pay really close attention to this, okay? As in the different types of instruments that are assessment instruments, and I'm sure Ruth will have pictures and show you which is which. You need to be able to know, identify by looking at which is an assessment instrument and which would be a treatment instrument. So as she has calculus removal instruments, that would be treatment because you're actually providing treatment. So assessment, you guys remember the steps of the hygiene process of care way back at the start of the semester? What's the acronym for that?
ADPI.
ADPI, right? Yeah. So the A stands for what?
Assessment.
Right? D stands for what? D stands for what? Planning, right? So the assessment instruments help with the assessment, then you get all of the information, then you diagnose, plan, then the I stands for what? Implementation. So the calculus removal instruments will be treatment instruments for implementation, that part of your ADPI. You guys following that? So make sure you understand the difference between assessment instruments and calculus removal or treatment instruments. They would be in the implementation phase of the dental hygiene process of care. Thanks. Sorry.
it's okay. So you have assessment instruments broken down into two different categories, periodontal probes and explorers. And then you have calculus removal instruments or treatment instruments. Those can be broken down into sickle scalers, curettes, and periodontal files. And there's also like chisels and hoes. Those are like for really heavy calculus. And I never saw those in our dental hygiene course. Okay, so here's the examination instruments. This is what you would call a basic setup. When you have a tray, you would want all four of these instruments on your tray. And these are to do an assessment. You have your mouth mirror, you have your probe, it's right here, and explorer, and your cotton pliers. So the mouth mirror, you would use that for indirect vision. So when you're looking in your patient's mouth, there's areas that you don't want to be bending over and trying to look in their mouth. Like, it's going to hurt your back, and over time it's going to really hurt you, and you're not going to be able to practice very long. So you want to use your mirror for indirect vision so that you can just hold your mirror there, and you can keep your back straight and your neck straight, and you can see in those areas that have limited access. And then you have your indirect illumination, so you can actually use your mirror so that when the overhead light is shining down on your mirror, it can illuminate certain areas in the mouth that are dark and you need more light. Then you have transillumination. That's when the light's actually shining on the mirror and you're shining it through the teeth and you're looking at the enamel of the teeth and you're looking for decalcification or carious lesions or thin enamel, stuff like that. So that's what transillumination is. And then you can also use your mirror for retraction. So there's patients that will constantly be trying to play with your instrument with their tongue. And so you're going to use your mirror to keep that tongue out of the way so you can do your job. You also probably use that mirror to retract the cheeks so you can get to those posterior molars. Here's the periodontal probe. This is a slender instrument. It's used to evaluate the health of the periodontal tissues. It has a blunt, broad-shaped working end. It's also circular or rectangular in cross-section. We'll talk more about cross-section later on. Its tip's rounded and smooth, and it's calibrated in millimeters. And there's so many different types of probes. So here's a few pictures of different ones. And here's some more. That's basically what the end looks like. As you can see, the end is really blunt. And you have the millimeters markings on here. And it's rod shaped. So the main purpose would be to identify diseased tissue. So that's where you have the deep pockets. You also want to assess the recession and the attachment level, and you can even use it to measure like intraoral and extraoral structures. So if you see like some kind of lesion on the cheek or neck, you would be measuring that and then charting that. Intraoral, you might find like a bite mark, or it could be even something that looks suspicious, like it could be cancerous. You would want to measure that in the mouth, keep an eye on it next time they come in, check and see if it's the same or if it's grown or if it's disappeared. So, here we have some more probes. The one that we use the most here at the school is the 15 UNC probe. And it's marked by every single millimeter. Then you have ones that are marked by every 3 millimeters. And this one I believe you use for implants because it's plastic. So again, that's the one that we use for boards and for here at the school. An Explorer, this is also another assessment instrument. It's used to locate calculus. Do you guys know what calculus is? Calculus is tartar buildup. It's that plaque that's gone hard that you come to the hygienist for them to scale off your teeth. So whenever I talk about calculus, it's that hard yellow stuff on your teeth. Then you're also looking for tooth surface irregularities, defective margins, and restorations and carious lesions. So you can fill a lot of things with this Explorer because it's very thin, slender wire-like, and it's very flexible. So when you're in the mouth and you're holding your Explorer, you have your fingers on the end, on this shank right here, and so you can actually feel vibrations. And when you're on the tooth and the crown and the roots, you'll know what's normal, what feels normal, and then you'll know what's rough and what's not normal. And then you can, through that, try to detect whether it's calculus or whether it's a tooth surface irregularity, or maybe it's just a restoration that you're feeling. There's lots of different kinds of Explorers. There's the shepherd's hook. There's the straight. These ones are mostly supragingival. Supragingival, do you guys know what that means? Above the gums, above the gingiva.
You guys don't talk today? You did talk to Miss Lev. She's nice.
So, you wouldn't want to use this in a pocket underneath in the sulci. You wouldn't want to use these Explorers because they have the sharp point and you could actually damage the tissue. And the way that they're shaped, it's just not, the angles aren't right. You wouldn't be able to get in the pockets well and do your job. So you just use it on the crowns of the teeth. And these ones are curved. This one's a pigtail. These ones you can use subgingivally underneath the gums and in the pockets, but they have to be very shallow pockets. And these ones are more for the deeper pockets, but they're also for the crowns of the teeth, shallow pockets, deep pockets, everything. But the best Explorer, and the one we love here, is the 1112. It's got a very complex shank. You guys remember what complex shank means? More than one bend, at least 2 bends in the plank. This one, I believe, has 3. 1, 2, 3, 4, I guess. So it's very complex, and you'll be able to use it on the anterior teeth and posterior teeth. You'll be able to use it interproximally. You guys know that word?
Which one do you use more?
Which one do you use?
Yeah, like the most.
The 1112. The 1112. It's awesome.
There's one right in front of you.
Where?
On your right hand side.
Oh, these ones, I thought this is a, This one's a-
Dale Skaters.
this is area specific and this one's a Cure universal.
Oh, sorry. Is that not
But it kind of looks like it. But this is actually what we'll talk about later. Okay, so then we have cotton pliers. You're going to use these to remove things from the oral cavity. So probably most likely rolled cotton and gauze and stuff like that. Sometimes you'll use it for floss. And when you get to expanded functions, you'll use it a lot more when you're placing wedges and things. These are the treatment instruments that we're going to talk about: sickle scalers, curettes, and periodontal files. And in order to really understand and identify those better, it's important to understand cross sections. So when you're looking at a pencil, a lot of pencils, if you are looking at a pencil long ways like this, and you cut it in half, the cross section would be kind of like a hexagon shape. Does that make sense? So when you're looking at the cross section of a scaler, it's more triangular, and when you're looking at it of a curette, it's semicircular. So here would be semicircular, this would be a curette. What?
Flip back to your PowerPoint.
How do you go back?
Flip back to your PowerPoint.
Oh, thank you. Okay, so pencil would be hexagonal, scalar triangular, and a curette semicircular. And this picture shows you a curette with a semicircular cross section. So, and then just to identify more parts of the blade, there's the face, there's the cutting edges. This is what you hold up against the calculus to remove it. And this would be the back, and here's the toe or the tip. Okay, so here's a scaler. You can see that the face is flat. The cutting edges, there's two cutting edges. You have the tip, which comes to a sharp point. It's triangular in cross section, and you use it for supragingival scaling. So you don't want to go below the gums, or if you do, you want to just go like 1 millimeter, maybe 2, but not very much more than that. And the reason being is because you could damage the tissue. So here's two scalars. The 204SD comes to a point, as you can see. This is used because of the bends. Where would you use it? No, you don't want to use supragingival. You're right. That is right. But look how this shank's straight and this shank is bent. Do you guys remember? Straight shanks, the simple ones, we want to use anterior. And then the ones that are more complex and they have the bends, the reason why is because we're trying to get to an area that has very limited access. So the bend helps us get back further. So the more bends, the more farther back in the mouth you're going to be. Okay? So this one's used for the molars, premolars, and this one's used for anterior teeth. Then we have the curette. It's an instrument also used to remove calculus from the crowns and the roots of the teeth. So this one you're going to go subgingivally. The working end has a rounded back and a rounded toe, semicircular in cross section, and there's two types: the universal curette and the area specific. So universal, it can be adapted to any tooth surface. Okay, that's very important. Universal, any tooth surface. Okay, its face is perpendicular to the lower shank. That's also very important to distinguish between area specific and universal. Okay, you have a 90-degree angle, and the cutting edge is continuous around the face, both sides and also around the toe. You also have to determine when you're in the mouth which side to use, which cutting edge is correct.
Are all the curates that you use are universal? Or most of them?
There's universal and area specific, so it just depends. You use them both. It's also a matter of preference, which do you prefer using? Some people prefer the area specific over the universal, but some just like to use one instrument for everything.
Darian, a universal curette you can clean everywhere in the mouth. If you have a really difficult patient or a really heavy calculus or a spot that you can't get to, that's what an area specific is for. Area specific can only be used in a specific area.
Oh, so
So,
you guys do
they're-
you always use it then?
Yeah, so they're
You'll be
designed to
using both.
use them in just one spot. And that's when, if you're having a really hard time getting to that one spot with your universal instrument, then an area specific has a little bit of a longer shank and it makes it easier to get to that area. But you can't use it somewhere else. Well, you can, but it's not designed to be used somewhere else.
So here's the universal. You've got two cutting edges. You've got the rounded back. You've got the rounded toe. And again, the face is flat and it's at a 90-degree angle to the shank. And here's another picture of a universal. So area specific, like Ms. Walsh was saying, is for a very specific surface that you'll be using. Its face is offset approximately 7 degrees to the lower shank, and the cutting edge is continuous around the face. And then only the longer outer cutting edge that is lower when the handle is held vertically is used during instrumentation.
Hey guys, what I want you to concentrate on knowing is the difference between treatment and assessment instruments, okay? Then when it comes to curettes and scalers, know the characteristics of a scaler. What are some of the characteristics of a scaler?
Sickles.
Of a sickle scaler. What are some of the characteristics of a sickle scaler?
Cross section?
Yep, what is the cross section of a sickle scaler? Scaler, right there. Sickle scaler, what's the cross section? Triangle, and a pointed toe. So a scaler is to be used above the gum line. Sickle scaler, they're all scalers, but a sickle scaler is used above the gum line. It has a triangular cross section back into this pointed, so you don't want it to go under the gum line. The toe is pointed, so you want to use it super gingerly. Okay, look forward. Curettes can be used subgingivally. Why? Because they're not pointed. You're right. So, kind of test questions you're going to be looking for is, which instrument would you use subgingivally? Why? What design characteristics make this either a sub or a super gingival instrument? Is that making sense? I want you guys to be aware that there's a universal and an area-specific curette, that they're for different areas. Universals can be used everywhere. Area-specifics can be used only in one area. But as far as angles and that kind of thing, right now, you'll learn that in hygiene school. I just want you to have a good grasp. Ms. Webb is just kind of giving you an overview, which is great, but what I want you to focus on and concentrate on is know you understand the difference between the two types of instruments and what is to be used above the gum line and what's to be used below the gum line. Sorry, go ahead.
Okay. So this is an area specific. You still see the semicircular, same as the universal curette. The only difference is the angle, and you're only using the lower cutting edge. Okay? So here's a picture of area specific. And then we have the periodontal file. This instrument has several cutting edges. You'll see on this one there's like 3 blades. And you use this instrument to crush heavy calculus. So you won't be getting all of the calculus off this instrument. It's just to kind of break it up, and then you go in with your other instruments and fine-tune it and get everything off the other instruments. But it's also known as a treatment instrument. So, and then that's the end. I used the Wilkins book, and there's also the Neil Gehrig book. I don't know if you guys will be using those when you get into hygiene school, but that's what we used. And I also used some pictures and information from Nicole Dickey's Theory 1 class. So she took some of the pictures herself too. And we have an activity, probably about 10 or 15 minutes. You guys can divide up into like 5 groups, maybe 4 groups. So you 4, and then you 4. How many people are here?
Christina, do you want to come make a foursome over here?
Why don't we divide into 5 groups actually, 3 to a group. And then maybe one of you will just have 2. And I'll ask these instruments. Can you come around here?
This is
So
the one with
I'll have all of you look through these instruments, see if you can identify it as a probe or explorer or mirror or cotton pliers. Then I want you to
there's the mirror.
also look at the treatment instruments and try to see which one's the universal, which one is area specific, and which one is a scalar.
So this one will be.
I'm guessing
You guys can take them out of
this
the bag.
one's universal
So take them out of the bags and really handle them and look at
because
them.
it only has one angle, and that one's going to be area specific. I think that one has the
And then I'm just going to come around to each group and kind
and
of
this
ask
one's
you
so
what
this
your
one's
thoughts are.
that one's a little super gingival, and this one's the system. Okay, do we guess right?
Let's see.
This one's the subgingival because it's got the railroad. It's not triangular.
Subgingival, yep, I think you're right.
And it's also the universal one because there's not a lot of bends to it.
You're right about it not having very many bends, so you would use it on the anterior teeth, right? But as far as
What is the numbers?
being a universal, if you look at it more closely, this one has one cutting edge that's lower than the other. And if you look at the handle and you read it, it says G12, and G stands for Gracie.
Gracie, okay.
And Gracie is always area specific.
Oh, okay.
But it does look like a universal
Is the
in
one
the fact
to me
that
that
it's
it's the
round.
front teeth? Or does it, wait, no, number.
1, 2, anterior, you're right.
Oh, okay.
1, 2 because it's closer to the front. You'd see like 13, 14, 15, 16 for more
This doesn't,
posterior.
but the teeth numbering starts in the back and then goes across and then back down around. Is that, so it doesn't have anything
It doesn't have to
with
do with the exact number.
Okay.
But it is, because it says 1, 2, it's more towards
more
the
towards the front.
front.
Cool. And that's the probe, the measuring tool.
Do you want to tell me what this is?
There's that one.
For it's area specific, right? Because it has more bends. This one, it has more bends, so that means that it's used posteriorly, so farther back in the mouth. And then if you look at the cutting edges, there's no lower cutting edge, and it's semicircular and rounded. So what do you think? If it's got two cutting edges and rounded back and a rounded toe, what do you think? And if you look here on the handle, it says Barnhart 5'6". So I'll help you out here. This would be a universal. If it was area specific, you would have a lower cutting edge. So it'd be. So you, yeah, if you look at it, the edges are the same. And what do you think about this one?
Well, no, it's a scale.
Ruth, can I get the carrots?
Yeah, go around and help everyone. Oh, get out the carrots, sure.
Get out the carrots. Please complain.
I mostly want them trying to identify what it is.
Identify if it's
You only want to do is
treatment
above
or
the
examination assessment instrument, and it's what kind of scalar or charrette it is,
H67 is the name
and
of
once you've done
it.
that, we can trace things.
And it's an American Eagle design. So, and then what is this?
That's the 1112. It's the in 1112 is the what is it called?
Okay, so
my mind is like
It's got a lot of bends, so it's for the
it's not the treatment. It's the
Yeah.
the assessment tool, but it's
It's an Explorer.
Explorer. That's the word I was looking for.
Good job.
Sorry.
What are we supposed to?
What do we do with the
There's
carrots?
your Explorer.
I mean, I'm hungry and everything.
We use the scale on the
Universal curette.
calculus on
Yeah, sorry, area specific curette. This is another curette. It's a universal curette because it's rounded in the toe. And then this is a single curette. So you have pointed at the back. The way that you scale, you can use a fulcrum right here. Like this.
You said to put your finger on the like something about the vibrations.
Feel, this is a tooth. You can feel the tooth like that. So you can take your carrots, and if this is called your fulcrum, just take it off. Did she show you how to scale and fulcrum?
We're just playing.
Okay, go ahead and play. You separate them out. This is your Explorer, so you can hold your Explorer and just feel it like that.
Okay.
Just hold it kind of like a pen.
Oh, so okay. Yeah, I was trying to figure out how to put your finger on the.
I'm coming.
So it's this finger that hits the.
Yes, the sickle scaler, yes. And that's an anterior sickle scaler. Yes. That is a universal curette. It's rounded, yes, and it's got lots of bends, so like that. And that one, that's an area
I wish we went to beauty school by the end of this class. Would have been way easier. I mean, wouldn't have had to pass anatomy.
I haven't done any of that.
I love my chemistry test.
Do you have a good teacher?
Yeah, I still have you done chemistry? No, chemistry. Have you done anatomy? Yeah, how's the anatomy? It was ugly. Who'd you have? Start with an M. You must have had the one they tell you to avoid iron and get this class fills up fast. That was what I heard. I signed up early. Yeah.
One, two, three.
Anyways, I have it written down at home. But yeah, so he was good.
Are you taking it next?
Next, yeah, I'm taking it in the fall. Yeah, so it's,
Do you guys figure out what the instruments are? Yeah.
I'm gonna measure in millimeters. Carrot. Oops. At the end of the carrot.
Dixie doesn't offer what I would go into right off the bat if it was a bigger school. So looking at the things that they do offer.
What were you wanting to go into?
Geology.
Geology. Oh. I guess there's some geology aspects to cleaning people's teeth.
This has really good hours and pay scales. Yeah,
I'm
it's still
going
in
to
the
pass
same
out a post quiz. It's just 5 questions. So this is just going to help me know how well I did teaching. It's not going to be graded, so don't worry about that. And the last question, there's a little error, but I corrected it, so just don't mind that.
Hey guys, when you're playing around scaling, I'm just going to show you the actual grasp of the instrument that you need. Would you pass me one of those scalers?
My notes are in it.
Yeah, that's fine.
And then maybe the last minute we can...
Okay. Hold your instrument like this. So as if you were picking up a pen, okay? You're going to pick up a pen to write, right? Hold it, have it, see how my hand's like this in a nice C shape? So get your instrument in a nice C shape like this, okay? Then bring this finger, the naughty birdie finger, down on your instrument like that. Can you see that? That's the way you want to hold it. Now when you have your carrot, if you want to feel the edge of it, like an explorer, you'll hold your carrot, okay? And fulcrum with this finger, your ring finger, on the carrot, okay? And then pull up, okay? That's the way that you'll do it. If the instrument doesn't feel right, you're using the wrong end at that point. So flip it over. Does that make sense? This one, it doesn't matter. But some of them, you'll do it and it'll feel really weird. It's just because that's not the end of the instrument. It will be an upper instrument or something. So, okay. Have a little play and do your post quiz. Madison? Good job. That was good. Did you enjoy it?
It's hard for me to know how much or how little.
I know.
Especially when I need to take a full hour
Yeah.
or full 15 minutes.
Have they done another quiz?
Yep, as soon as the quiz is done, you guys can go, or if you want me to go over the answers, I can.
Working on it. And go with working on it.
Some people like to know if they got it right or not.
So when you guys are done with your quiz, you can hand it in, bring all the instruments back, throw the carrots away. Okay? Did anybody come in late that I didn't count in the roll? Okay? All right, if you came in late and I didn't count you, it's your own fault. Close my internet.
Assessment. It's not assessment. It's no, it's not explorers. No, it is. It's assessment.
Do I need to send that PowerPoint to you, or you got it just now?
I didn't get it. Would you send it to me? This is awesome. You don't need photos for anymore, right? Figured that would be too, we don't turn those off because they run out and they're very expensive.
I'm just bringing some examples of the I bought some my first year, or like during the summer, my first year during the summer. And then right before boards, I bought examination and then my new one. I was going to give you one of these too.
Hey, you guys have a great spring break. I will. I think you scared them, Ruth.
That's Karen. I'm
You guys
sorry.
just burned out. You're just ready for spring break. You're not even talking today. It's like, wow.
But I have 2 reports to write during it, so I'll be. Hopefully they're not huge.
Well, if it makes you guys feel any better, I had a whole thesis to review. About 120 pages.
Go ahead and turn this off.